Gentlemen, if you're a man over 60 and you're looking to significantly boost your erectile strength and overall male vitality, listen closely, because what I'm about to share could change everything for you in ways you never imagined. Hello, everyone. I'm Dr. David Chen, a board-certified urologist with over 25 years of experience helping men just like you navigate the challenges of aging with grace, confidence, and renewed energy. Today, on my channel dedicated to straightforward, science-backed health advice, I want to talk to you like we're sitting in my office. Face-to-face, no judgments, just honest conversation. If you've ever felt that spark of frustration when things aren't performing as they used to, or if you wonder if there's a natural way to turn back the clock without relying on pills or invasive procedures, you're in the right place. This isn't about hype or false promises. It's about empowering you with a simple, 3-minute daily exercise that's grounded in real medical science. And trust me, by the end of this, you'll feel inspired to give it a try and reclaim that vitality you've been missing. Let me start with a story that hits close to home for so many of my patients. I remember John, not his real name, of course, a retired engineer in his mid-60s who came into my clinic one afternoon looking defeated. He was a family man, active in his community, but he confided in me that his intimate life had taken a hit. "Doc," he said, "I feel like I'm letting my wife down and it's eating away at my confidence." John wasn't alone. I've heard variations of this from countless men. As we age, our bodies change, hormones shift, blood flow slows, and everyday stresses pile up. Conditions like high blood pressure, diabetes, or even the side effects of medications can quietly sabotage erectile function. It's not a sign of weakness. It's biology. But here's the beautiful part. Biology can be influenced. John's journey back to vitality began with understanding his pelvic floor muscles, those hidden powerhouses that play a starring role in male health. And yours can too. You see, your pelvic floor isn't something most guys think about until there's a problem. Imagine it as the foundation of a sturdy house. It's a group of muscles and tissues stretching like a hammock from your pubic bone at the front to your tailbone at the back. These muscles support your bladder, bowels, and prostate, but they also directly impact your sexual health. When they're strong, they enhance blood flow to the penis, improve nerve signals for better sensation, and help maintain that firmness we all want. Weak pelvic floor muscles? They can lead to leaks after urination, premature ejaculation, or those frustrating moments when erection just doesn't hold up. But the good news is, like any muscle in your body, you can train them. And that's where this 3-minute exercise comes in. It's called Kegel exercises, named after the doctor who popularized them decades ago. Now, I know what you might be thinking. Kegels? Aren't those for women after childbirth? That's a common misconception, and I get it. Society hasn't done a great job highlighting how vital they are for men. But let me assure you, gentlemen, Kegels are a game changer for us too. They've been studied extensively in medical journals, showing improvements in erectile dysfunction for up to 75% of men who commit to them regularly. Think about it. No gym membership, no equipment, just you and a few minutes a day. It's discreet, effective, and empowering. Let me paint a picture for you. Picture Mike, another patient of mine, a former athlete now in his 70s. He started Kegels after a prostate scare, and within weeks, he was telling me how his confidence soared. "It's like I got a second wind, Doc," he said with a grin. Stories like his keep me passionate about sharing this knowledge. Before we dive into the routine, let's make sure you can identify these muscles correctly, because getting this right is half the battle. Sit comfortably or lie down if you prefer. Now, imagine you're in the middle of urinating and you suddenly need to stop the flow. Feel that squeeze? Or think about holding in gas in a crowded room. That subtle lift inside. Those are your pelvic floor muscles engaging. It's not about clenching your abs, thighs, or buttocks. Those are the wrong spots and can actually make things worse. Focus on that internal upward pull, like drawing everything gently toward your belly button from below. Practice a few times right now as you listen. Got it? Great. If it feels tricky at first, don't worry. Most men need a couple of tries. You can even try it while actually urinating to confirm. But don't make a habit of that, as it can confuse your bladder signals over time. All right. Now for the heart of this, your 3-minute daily routine. I've designed it to be straightforward, so you can slip it into your day without hassle. Maybe during your morning coffee, while commuting, or before bed. Consistency is your best friend here. Think of it like brushing your teeth for your pelvic health. We'll break it into 3 one-minute segments, each building on the last to strengthen endurance, speed, and stamina. Ready? Let's go step by step. First minute, the slow, steady holds. Start by gently squeezing and lifting those pelvic floor muscles. Hold for 3 to 5 seconds. Feel the tension build, like holding a light weight. Then, release completely for the same amount of time. That full relaxation is crucial. It allows blood to flow back in and prevents fatigue. Repeat this 10 to 12 times. Why does this matter? It's like doing slow reps at the gym. It builds the core strength needed for sustained control. Imagine you're training for a marathon, not a sprint. This sets the foundation. Moving to the second minute. Quick pulses, or what I call the rapid flicks. Now, squeeze and release as fast as you can, like fluttering your fingers. Aim for a quick on-off motion, fully letting go each time. Do this continuously for the full minute. This part hones your muscles' reflexes, making them more responsive. In the context of intimacy, it means quicker, firmer erections when the moment arises. One of my patients, Tom, a busy executive, loved this because he could do it during conference calls. No one wiser, and he saw results in his bedroom confidence within a month. Finally, the third minute, endurance holds. Squeeze as before, but hold for 10 to 15 seconds or longer as you get stronger, without holding your breath. Breathe normally. Stay relaxed elsewhere in your body. Then release fully and repeat 3 to 4 times. This is your stamina builder, teaching your muscles to maintain that grip for longer periods. Picture it as a final push in a workout. It's where the real gains happen for lasting erectile strength. That's your routine. Simple, right? But don't let the ease fool you. The science behind it is profound. Let's break down why this works. In plain terms, during an erection, blood floods into the penis's spongy tissues, like filling a balloon. To keep it firm, your body needs to trap that blood by compressing the veins that would otherwise let escape. That's venous occlusion, a fancy term for locking in the pressure. Your pelvic floor muscles, especially the bulbocavernosus and ischiocavernosus, don't worry about the names. Just know they're key players. Act as that lock. Strengthening them through Kegels improves this mechanism, leading to harder, more reliable erections. Studies from places like the Journal of Sexual Medicine back this up, showing men over 60 experiencing up to 40% improvement in erectile quality after consistent practice. But the benefits ripple out further. Enhanced blood flow means better oxygenation to the tissues, which can heighten sensitivity and make climaxes more intense. Emotionally, it's a boost too. Regaining control fosters that deep sense of masculinity and connection in relationships. I think of Sarah and her husband, who came to me together. He was skeptical at first, but after incorporating Kegels into his routine, their intimacy blossomed again. It's like we're newlyweds, she whispered to me during a follow-up. Stories like theirs remind me why I do this. Health isn't just physical. It's about joy, closeness, and living fully. Of course, Kegels aren't just for the bedroom. They support prostate health by improving circulation, which can ease symptoms after surgery or with benign enlargement. They tackle urinary issues too. That annoying dribble after you think you're done? Stronger muscles can stop it. And for those dealing with premature ejaculation, the control you gain from these exercises can extend your staying power, turning quick encounters into satisfying ones. It's holistic medicine at its best. No side effects, just your body working smarter. Now, a gentle word on what not to do, because I want you succeeding, not struggling. Common slip-ups can derail your progress. First, avoid bearing down like you're straining on the toilet. That's the opposite direction and can weaken things further. Always lift up. Second, don't hold your breath. Keep it natural to avoid building unnecessary tension. Third, isolate those pelvic muscles. If your belly or legs are joining in, reset and focus. Fourth, resist the urge to overdo it. 3 minutes a day is plenty. Pushing too hard leads to soreness, like overworking any muscle. And if you're new to this, start slow, build up as your body adapts. I have to emphasize this with all the care in my heart. While Kegels are a wonderful tool, they're not a standalone fix for everyone. If you're facing persistent erectile challenges, pain during intimacy, blood in your urine, or any pelvic discomfort, please promise me you'll see a doctor right away. These could signal deeper issues like cardiovascular disease, hormonal imbalances, nerve problems, or even early prostate cancer. As your virtual guide here, I urge early intervention. It's often the difference between a minor tweak and a major concern. Think of Kegels as a supportive ally, not a replacement for professional care. I've seen too many men delay, only to wish they'd acted sooner. Your health is worth it. To maximize these benefits, weave Kegels into a broader healthy lifestyle. Eat nutrient-rich foods. Think leafy greens, nuts, and fatty fish for heart health and blood flow. Get moving with walks or light cardio. Aim for 30 minutes most days to keep your vascular system humming. Manage stress through meditation or hobbies. It lowers cortisol, which can sabotage libido. Prioritize sleep. 7 to 8 hours nightly recharges your hormones. And stay hydrated. It's simple but vital for tissue health. One patient, Robert, combined Kegels with quitting smoking and daily yoga. 6 months later, he was a new man, full of energy and optimism. You can be too. Gentlemen, as we wrap up, I want you to know how much I believe in you. Taking charge of your health, especially in areas society shies away from, is an act of true strength. This 3-minute routine isn't just an exercise. It's a daily affirmation that you're worthy of vitality, confidence, and deep connections. Start today. Feel the difference. Share your wins in the comments below. If this resonated, hit that like button. Subscribe for more empathetic, expert advice on men's health after 60, and turn on notifications so you never miss a video. What's one change you'll make this week? Let me know. I read every comment and love hearing your stories. In my next video, we'll explore prostate screenings, when, why, and how to stay ahead. Until then, take care of yourself. You deserve it. Stay strong, stay vital.